Ka Meghalaya ringkat shitulup ka perthei menta kasni kalaraki ya kasni ais nam snobha ya ka balatip kum ka National Voluntary Blood Donation Day. Ha ka day bat kani ka Meghalaya AIDS Control Society ringkat bat ka jinya trelang ka State Licensed Blood Center kilapanlong ya ka State Level National Voluntary Blood Donation Day Hasilia Hall Don Bosco Youth Center Lain Kra Shillong. Habakran hagan ikasni u Principal Secretary jong katanat ka koit ka kya ka Sarkar Meghalaya u Sampat Kumar ula kentui kinong song ka Meghalaya bakin long ki bakloy ban ais ngo bhaya kasnam jong ki ya kito ki badon kam klem jin shimpisa ula itu baka jilla Meghalaya karang don kam shibun ki brio ki ban ais ngo bhaya kasnam jong ki ban pinbiang ya kata ka jing don snam ya kito ki badon kam.
So these are the occasions which are very very important, and I must say that though we have a lot of challenges in the state, but we are progressing very well. In fact, we are able to collect over 14,000 units of blood in the state. So that's quite a very positive step, because we have seen the blood donors who have come today, and it's really remarkable. And we call them positive deviances. Positive deviance means where in a place where you're not finding many donors, but you're finding some of them are coming and they are inspiring others. So it's a very very positive step. I think we should understand, learn from the positive deviant stories, and we should really propagate. Today, in a state, in our state, we have around currently maybe our population will be around 3.8 million population. So for every, that means 38 lakh population will be there. For every basically for 1 lakh, or like you can look at like 1%, like 1% of the population might require blood transfusion services. So coming to the another important thing the state government has brought out this year, and we have taken this COVID period to learn a lot of things, understand what are the health challenges, what are the health basically the issues that where we need to focus upon. So based on that iterative process, constantly that what we have done from the last more than 1.5 years. So we have brought a state health policy. In fact, the state government has brought a state health policy. The state health policy is actually essentially aimed at promoting positive healthcare. Positive healthcare means it's like most of the time health means what people do. They look at when the problem comes. That means what does it mean? So if somebody has a problem, then only actually they come for the healthcare. But we have to understand that there is another important dimension is the prevention. There are a lot of things that what we should do before actually one seeks a curative healthcare. So the state has brought this positive healthcare model where we are going to focus on preventive along with curative and also enabling. So preventive, curative and enabling. These are the three dimensions through which we are going to work, and we are working actually. And this is giving some good results also. The way actually this is one of the examples that what we have actually celebrated today. How actually we are trying to improve the blood transfusion services, because one of the reasons why the blood transfusion is required is that because when I'll give an example. Out of the pregnant women what we have in Meghalaya, as per the NFHS data, 53% are anemic. What does it mean? Pregnant women, anemic is not, basically, then if they are severe anemic, you require blood transfusion services. You require, and if there is a retained placenta during the delivery, if there is a postpartum hemorrhage where, so in such cases you definitely require, blood transfusion. So this is where, we require a lot of awareness about it, that, how actually we can prevent that, before coming to that stage. Can we prevent the anemia? Can we reduce the anemia before actually, they come for the delivery? So these are the things that we have been working now, like putting a lot of focus on that preventive aspects. At the same time, when there is a need, we should be able to have the services. So that's another very important thing. And I'm sure, with this kind of an efforts, with all our collective efforts, with both the government and the missionary hospitals and the private hospitals. entire civil society organizations that are working for the promoting this voluntary blood donation. I think we should be able to, meet that challenge, and we should be able to provide, the better services to the people. So with this, I would like to again, congratulate, the team that is working for, organizing this one. It's very, I really wanted to place an appreciation for the Meghalaya AIDS Control Society for the entire team coming together and, basically giving a song, presenting a song that is inspiring everybody. So the idea is that.
So that they know it's a better world for them. And think if they can make it a better place. I think all of you know the song. So this is the name of the song, Heal the World. Kindly join us because this song is very apt, especially during this time of the pandemic.